We are so pleased to have on our live line because this whole discussion, we have it many times relative to the MIA Mission Policy Act and policy updates, and we can get it all. We have Suzanne Gordon with us on our live line. She's the author, Wounds of War, co-editor, The Culture and Politics of Healthcare Work Senior Policy Fellow, and Veterans Healthcare Policy Institute. How are you, Miss Gordon?
I'm great. Thank you so much for having me.
It is a pleasure to have you. This is so important, and I just said it a lot. The VA Mission Act policy updates. Help us here. Tell us what's going on.
Well, the Mission Act was enacted in May of 2018 as a follow-on to the Choice program, and basically it was supported by almost all Republicans and an overwhelming number of Democrats who I think should have known better. And it was also supported by a lot of veteran service organizations who should have known better, in my view. And it was enacted, and it gives broad powers. It gave broad powers to Secretary Wilkie to create eligibility standards for veterans to go to private sector care. It also expanded the caregiver support program for veterans who are very severely disabled and need family caregiving at home. But unfortunately, the Mission Act has been used by the Trump administration and Secretary of Veterans Affairs Robert Wilkie to try to push more and more veterans out into private sector care. And the problem with that is that most private sector providers, doctors, hospitals, and so forth don't really understand how to take care of veterans because veterans are a very specific population, and they really need very particular kinds of services, and people need to really know what they're doing when they're taking care of veterans. So you can't just you can't just have any doctor or hospital taking care of veterans because, as you know, veterans have more mental health problems, they have more chronic pain, they have PTSD, they have exposures to toxic substances that most of us never breathe in. And so you really need to know what you're doing when you take care of veterans. And the Mission Act is really sending people out to people who don't really know how to take care of the very specific problems veterans need. So I've been trying to follow this with the Veterans Healthcare Policy Institute, and also I've been writing about it with my colleague Jasper Craven, and we've written several articles for the American Prospect, most recently the Washington Monthly, and then, of course, I wrote a book called Wounds of War, which looks at how the VA specifically takes care of veterans.
Now, what is the situation going on here, Ms. Gordon? Was the whole idea was to push the veterans into private help, medical help, so the folks outside of the government can make more money? Is that what was?
Well, I mean, the Democrats who voted for this law and the veteran service organizations who lobbied for it kind of say that that they thought that the veterans, that this Mission Act would allow people out for if it was in the best medical interest of the veteran. And they claim that's why they voted for it. The problem is that the standards that Secretary Wilkie set have nothing to do with best medical interest, and basically he set standards that allow you to go to private sector care if you have wait times of more than 20 days or have to drive more than 30 minutes if you need a primary care or mental health appointment, or 28 days or an hour if you need specialty care. But there's no analysis at all of whether wait times, drive times, or quality of care is better in the private sector. They're just trying to push people out. And basically, our research and investigations and discussions with veterans have shown that that's exactly what they're doing. They're trying to get veterans out into the private sector, even though they could provide those services in the VA. I mean, for example, the VA is a leader in telehealth, but, you know, they're letting veterans go to private sector providers, and the private sector provider says, well, I can't see you, you know, you'll have to wait for 4 months, but I can give you a telehealth appointment. Well, there is absolutely no reason for someone to get a telehealth appointment outside the VA, which has the best telehealth services in the country, even almost in the world.
What is that again? What kind of health is that, Suzanne?
Telehealth. So you're basically using your computer or through your telephone, you know, you're using...
Okay, I got you.
Basically, you can be in your house and set and have telehealth capacity to have a mental health appointment. I've seen VA providers do physical therapy, you know, from, like, I saw somebody get physical therapy in White River Junction from a PT, a physical therapist who was in North Carolina. I mean, the telehealth capacity is amazing. The VHA is doing huge amounts of work in telehealth to cut down on unnecessary emergency room visits. Now, you will never hear any of this from the mainstream media because all they promote is negative stories about the Veterans Health Administration. It's really remarkable, and veterans really should mobilize. I mean, it's the problem with the VHA is that the Veterans Health Administration is that it is the most accountable and transparent healthcare system in the country. So every tiny little glitch that happens is reported in the Veterans Health Administration. There's the Office of Inspector General, the General Accounting Office, Congress, and so forth. So, and the media picks up on these negative stories, but doesn't pick up on any positive stories. So, for example, the New York Times just ran a story a couple weeks ago about a legislative aide from Capitol Hill who went to the VA hospital, and was assaulted by a veteran patient, a female. And so there was this whole thing about, isn't this terrible? Women are badly treated in the Veterans Health Administration. Well, what's interesting is she wasn't assaulted by a doctor or nurse or caregiver. She was assaulted by a veteran. So the question becomes, how come so many male veterans have these negative views of women, and where does that begin? You know, is it in the community of origin or is it in the military? But there's no discussion of what the VHA has done to try to accommodate women veterans. That's a story, that I've written, but it's not a story that you'll read about in the media. I mean, 14% of women are now in the military. The VA's patient population is 7%. And you have a healthcare system where 7% of its patients are female, and they have set up an entire women's healthcare system within the VHA. That's extraordinary. Nobody ever talks about that, including the Iraq and Afghanistan Veterans of America who have publicized this problem of the treatment of women veterans.
So looking at the whole thing as you have done, Suzanne Gordon, we've got people saying the Trump administration is sabotaging veterans' access to health care. You've got people on both sides of the aisle saying one thing and the other. What should you be telling our listeners? What in fact is going on with the VA?
Well, I think what's going on is that the Trump administration, is great pals with private sector hospitals, with the Koch brothers, the billionaire. Well, now there's only one of them. Mm-hmm. So because David died, and so Charles is the only one remaining. So you have people who are ideologically allergic to anything the government does that's good and want to destroy it. And then you have hospitals, pharmaceutical companies, and so forth who want the $90 billion budget of the VHA for themselves. And I think really veterans need to understand and ask a lot of questions when somebody tells them that they should go to the private sector. They should be asking, can you assure me that the quality of care in the private sector is better than the Veterans Health Administration? And guess what? Nobody will be able to assure them of that because the care in the VHA is better. They need to ask questions about, okay, can you assure me that, the people in the private sector, Dr. Smith or Dr. X or Dr. Y, can see me quicker than the VHA, and they will not be able to get that assurance, And the problem is that if you say you want to go out to the private sector, let's say you call up the VHA and you say, I need a dermatology appointment, and they say, well, we can't see you until 40 days from now. You can go to the private sector. Well, you need to know that if you say, okay, I'm going to go to the private sector, and you discover, as is often true, that you can't get a dermatology appointment until 8 months from now, you can't call back the VHA and say, okay, I'll take that appointment for 40 days from now, because that you go back to the bottom of the line. And veterans are just they don't understand what this means. I mean, many veterans, tragically, and we talked, earlier about the media, many veterans read what they read USA Today or listen to Fox News, and they think that the VHA isn't good, which it is good, and they think, oh, I want to go to the private sector, that they're wonderful. And many Americans believe that government can do no good and the private sector no bad. And I've covered private sector healthcare for 35 years. I'm a patient in, private doctors and hospitals. And let me tell you, if I could get care at the VHA, I would sign up like the minute I hang up the phone with you.
Wow.
But I can't.
Yeah.
And I should be able to get that high-quality care myself, but I can't because coordinated integrated care that the VHA delivers just isn't available in the private sector.
That is saying so much, Suzanne Gordon, and you, of course, have studied this and written about it and so forth, and and you're saying the VHA is so much better than the private sector. Why do we have to have this conversation?
Yeah, really, what a good question.
Yeah.
I mean, why are they doing this? You have a healthcare system.
Right.
We have a healthcare system. So, Cliff, there's a thing called population health. And essentially, in healthcare, the wisdom now is you want to understand populations. You want to understand the specific problems of populations. And you have a population health system in the VHA that understands the specific problems of veterans.
Right.
You've invested billions and billions of dollars in that system over the past 70, 100 years. And you're getting a great return on your investment because you're getting high-quality health care at lower cost than is available in the private sector. Why on earth, as you ask, are we having this conversation? Why are they doing this? Well, I think they're doing it because they're either stupid or greedy. You know,
and maybe some of both.
or both.
Yeah.
And I mean, it's scary to me because a lot of people in Congress, including a lot of legislative aides, don't understand the Veterans Health Administration. I mean, the Veterans Healthcare Policy Institute, I'm a senior fellow and a founder, we put out a congressional guide on the VA, which you can find on Veterans, if you go to www.veteranspolicy.org. And we did that because so few legislative aides working, these are the people that are essentially educating our people in Congress and the Senate. Mm-hmm. And they don't understand the largest healthcare system in the country. They don't understand it. And, you know, the fact that you have a legislative aide who's a veteran doesn't mean that they understand the VHA. Mm-hmm. Mm-hmm. And, I mean, I hear things from some of these aides that are positively hair-raising, and I have to, like, bite my tongue, you know. I mean, it's like, really? You believe that, you know?
Thinking they would know better, right? Yeah.
Well, you would think that they would be educated, but, you know, they're very young. Mm-hmm. I mean, there's some people who work in these Senate and congressional offices that are amazing, but a lot of them are, you know, they don't know anything about health care.
Mm-hmm. Sure. Yeah. That is something. Our number is 312-374-8130. We've been getting some great information from Suzanne Gordon, who is just telling us all about the healthcare system with the VA and what is going on. And like she said, as soon as she would stop this interview, she would go because she'd get
I mean, I had dinner last night with a friend of mine who's a primary care doc at the VA in San Francisco. And I mean, I wish she could be my doctor. Like, why can't she be my doctor? I mean, it's hilarious because half the time, like if I have, you know, a healthcare problem and I go to my private sector doctors who I like, you know, fine, but they have no time to talk to me. I call my friends who were healthcare providers at the VA and, like, tell me what to do. You know, I mean, those are my tax dollars at work.
You know, it's good to hear you say that, though, because there's so many things that are put out about the VA. And, of course, here at you know, America's Heroes Group, we have great situations and relationships with the VA here, you know, in Chicago. And they do a great job, just like you're talking about. So we know better than a lot of this stuff that we hear. And thank goodness, Suzanne, there's people like you who really put the word out there, because a lot of folks have no idea really what's going on. So we just think,
I think that veterans who know better need to call their Congress people and ask them why they don't know better. I mean, I listen to the presidential candidates, and with the exception of Bernie Sanders and sometimes Beto O'Rourke, I mean, even the Democrats are using Republican talking points. And I think they think that they can prove to veterans that they're on their side if they bash the VA. Instead of, I mean, you know, the VA has some serious problems, mostly due to underfunding and poor management at the top. But they don't educate the American public. These, you know, I've heard Tulsi Gabbard, who's a veteran, say horrible things about the VA. Amy Klobuchar, I mean, it's frightening. And, you know, instead of saying, Cory Booker, instead of saying, you know, this is a great healthcare system that we have to improve, and here's how we can do it, and here's some problems we have to solve, they just go in there and start, you know, trying to get on the side of veterans by, you know, looking tough on the VA. By the way, Cliff, they don't say the same thing about the private sector healthcare system. They don't, you know, get tough about the pharmaceutical industry that jacks up our, you know, drug prices, or the hospitals that are, you know, suing patients or whatever. So they get to look like they're on the side of the American public and the kind of working stiff by flexing their muscles about the VHA, as opposed to, like, getting their act together about protecting American health care from the profiteers and the people that are running it into the ground for their own greed.
Suzanne Gordon, thank you so much for the education. Great job you're doing. We certainly appreciate you spending time with us, and we'll be talking again. Thanks, Suzanne.
Take care. Thank you so much.
You're more than